Our feminist practice project focuses on the topic of involuntary sterilization. Upon starting this project, none of us knew much about this social justice issue, so we hope to educate future women's studies students on this topic. I'm Kate Madoff.
I'm Megan Erskine.
I'm Courtney Colleen.
And I'm Emily Kalzer.
Here is an outline of our presentation on involuntary sterilization. We'll be talking about the history of involuntary sterilization as it pertains to U.S. history and the role of the eugenics movement in U.S. history, as well as it intersects with race, class, age, and gender. We will overview the types of procedures for sterilization. We will also examine the demographics of the eugenics movement through the use of intersectionality to explain why victims were sterilized. We will also review current events that involve involuntary sterilization in the U.S., and finally, we will review some key takeaways.
The history of involuntary sterilization in the United States technically began in 1907 when the first U.S. sterilization law was passed in Indiana on the grounds of eugenics. Eugenics was the study in improving the qualities of the human species or a human population by means of discouraging reproduction of people with genetic defects or presumed to have inheritable undesirable traits. So in 1914, as sterilization laws were gaining approval, the people targeted were those considered feeble-minded, criminalistic, socially inadequate, etc. By the 1920s, forced sterilizations were becoming all too common in the U.S., the majority of which took place in California. 2,500 had been sterilized there. Virginia also began implementing laws, and soon after the first woman was chosen to be sterilized, the constitutional validity of the law was challenged in court. Carrie Buck was a 17-year-old girl from Virginia with a child out of wedlock, and her mother was being held in an asylum for the epileptic and feeble-minded. It was determined that she had hereditary traits of feeble-mindedness and sexual promiscuity, so many testified against her in court, referring to her as below average and other disparaging terms. The case made it to the U.S. Supreme Court and the law was upheld, the justice being a eugenics scholar himself. While some statutes were repealed in the 60s and 70s, sterilization still continued using federal funds. Finally, after a revolutionary court case involving the Ralph sisters, two low-income women of color who had been forcibly sterilized, new regulations were put in place, including an age requirement of 21 years, a check to make sure the person was not mentally incompetent, and informed consent forms for the procedure, and a 30-day waiting period before the procedure. In the picture above, one of the signs reads, "I cannot read this sign. By what right have I children?" And in the picture below, the right page reads, "How long are we Americans to be so careful for the pedigree of our pigs and chickens and cattle, and then leave the ancestry of our children to chance or to blind settlement?" Essentially comparing the process of eugenics to the breeding of livestock.
Of sterilization procedures. All three of these procedures require the use of anesthesia. Sterilization can be performed after childbirth, abortion, in conjunction with other procedures, or any time during a woman's menstrual cycle. Laparoscopic sterilization uses a small camera to view the fallopian tubes. The fallopian tubes are heated or clamped to close them. Mini laparotomy, a section of the fallopian tube is removed from each side. Hysteroscopic sterilization uses small coils that are inserted through the cervix and uterus into the fallopian tubes. Scar tissue develops around these coils, causing these tubes to become sealed shut. Women can also have what is known as a hysterectomy, where all or some of the reproductive organs are removed. All of these procedures result in scar tissue development. During the eugenics movement, many women were sterilized directly after childbirth or when they went in for other medical procedures, and most women were not aware of this.
During the eugenics movement, there were two types of eugenic practices, positive and negative. Positive eugenics consisted of encouraging those with characteristics deemed desirable to reproduce. Negative eugenics consisted of marriage laws prohibiting the marriage of undesirables, stricter immigration control, sexual segregation of those with physical and mental disabilities, along with voluntary and compulsory sterilization. However, the most common practice of eugenics was negative, and among negative eugenics, involuntary sterilization was most commonly practiced. Targets for this included those suffering from insanity, epilepsy, alcoholism, pauperism, criminality, sexual perversion, drug abuse, and feeble-mindedness. These people were seen unfit according to society.
During the sterilization program in North Carolina, there were specific demographics of targeted victims of involuntary sterilization. Demographics of these victims were being female, non-white, specifically African American in the state, suffering from feeble-mindedness, and being young. In this case, some girls as young as 9 years old were targets of this program. A victim only needed one of these traits to be targeted. However, a combination of two or more of these traits increased the risk of being victimized. It was not just gender, but race, age, and intelligence as well.
Between the years 2006 and 2010, approximately 150 female inmates in the California prison system were sterilized against their will, using state funds, even though this once common practice was banned in 1979. The women targeted in the sterilization program were women who have served multiple prison terms, already had several children, or were likely to end up in prison once again. Many of the victims were under the assumption that they were receiving routine medical care and procedures, and took it for granted because this was likely the best medical attention they would receive for a while. As a result, many of the women underwent the procedure uninformed. The women who did give consent had come forward and have said they were coerced to unwillingly give into this procedure that made them feel, quote, like something less than an animal. Christina Cordero, a former inmate, adds, "He made me feel like a bad mother if I didn't do it. Today, I wish I would have never had it done." There is now a lot of action to reduce the amount of coercion that leads to sterilization, including a lot of discussion to define the word consent, which is often not a clear term. The definition of the word consent has especially been an issue of debate regarding the mentally handicapped, a demographic of people who in some cases are not able to knowingly give consent on their own. The discussion of sterilization is important because it is not a solution. Some mentally handicapped people undergo forced sterilization because their loved ones fear complicated pregnancies from sexual assault. But sterilization will not prevent people from being sexually assaulted. Instead, it is a much healthier option to provide sexual education classes and sexual counseling to people so that they may retain their agency. Consider these questions. What is the definition of consent? Can it really be consent if the patient was guilted or bribed into the situation? Can anyone ethically give consent for someone who is not able to on their own? And if someone does not give consent to a program, are there any other ways to protect their sexual health? And remember that sterilization does not prevent sexual assault, but is merely an unethical reaction to the presence of certain demographics.
Involuntary sterilization affected races and social classes in very different ways. Sterilization mostly affected lower-class women, for those who were uneducated were the ones considered feeble-minded or mentally incompetent. This is evidenced in North Carolina's program, where the last 15 years of its operation, 99% of its victims were women and more than 60% were black. The program targeted welfare recipients and the poor, and since black women usually occupied lower-paying jobs, they made up the majority of the victims. Obviously, the sterilization movement was occurring during times of social inequality in the United States, so those considered inferior were usually black women. Higher-class women were usually educated or considered superior, so the process had little effect on them.
Here are some key takeaways of our presentation. The process of involuntary sterilization is an extremely invasive procedure that results in permanent bodily scarring, and often women were not aware it was being done to them. It was based on eugenics, the process of improving the qualities of a population by selective breeding. Victims of sterilization were targeted for being female, feeble-minded, being of color, and having other traits deemed undesirable for reproduction.